determine when surgery is necessary? And I'm going to let you take this, Dr. Pazionis.
So when patients come to the clinic, essentially, they will oftentimes have tried conservative managements, they'll have tried injections, they'll have tried lifestyle modifications, and they still have bad pain. So really, barring anything catastrophic that requires surgery, which we'll talk about in a second, your decision to have surgery is essentially up to you. So you can either have the pain, or the goal of surgery is to take away the pain and oftentimes the deformity. Things that necessitate surgery are things like instability. So if your spine is moving back and forth on each other, so two vertebral bodies that you'll have right here, okay? If they're moving back and forth, these can actually damage your nerve roots, essentially, because if we look, and we're going to look at the biodigital graphic in a minute, but essentially, the movements of the bones themselves can squish the nerves, okay? Things like tumors, for example, may oftentimes require surgery or radiation or some sort of intervention, or fractures that can lead to instability in the long run. So barring any of those things, or nerve compression that causes difficulties with movement or paralysis, decision to have surgery is up to the patient.
And doctor, you obviously have conversations with your patients on when it's time, right?
Yeah, when it's time. Most of the patients, they know, and for the most part, the patient already is making the decision alongside with us. So we already are telling the patient, okay, you try A, B, and C. So basically, you try physical therapy, some medications, and despite the injection, either A didn't help, or they didn't help you long term, or you're having recurrence of symptoms. Despite doing an exercise program, so it's time just to take action and most likely start getting a surgical conversation. And for the most part, most of the patients, they take it well because they already know that they have tried all the steps prior.